I recently had a question from someone who is using one of my home programs to solve their pain. And their question is about the different types of pain that we have. And so I wanted to take a moment to answer those questions and cover the different types of pain that most people have heard of, because there's a lot of confusion and misunderstanding about them. So let's dig in. First of all, there's a term called nociception or nociceptive that refers to the body's ability or the process of sensing and alerting us to pain signals. We have lots of different types of pain receptors, and their ability to sense and transmit pain signals is nociception. So then we have acute pain, and that refers to pain that's happening for less than 3 months from, say, a fall or a type of trauma like a car accident or post-surgery. And then we have a term called chronic pain, which refers to pain that's been happening for more than 3 months. And as a physical therapist, I specialize in musculoskeletal pain, either acute or chronic, but most of my focus is on chronic pain because our bodies have amazing capacities to heal most problems in that magical 3-month window. So another term that people run into is centralized pain syndrome, which is neuropathic pain in the central nervous system. These are caused by like stroke or MS, spinal cord injury, or cancer affecting the central nervous system. Now, this is different from centralization. Centralization is the remission of radicular pain. So if you have pain going down your leg, say sciatic pain that you feel in your foot, that pain starts to reduce in the periphery, in the foot or the hand or the calf or the elbow or wherever it is. But what happens during centralization is that the pain will become more intense at the spinal level of where it's originating from. So centralization is the process of reducing radicular pain. And that's opposed to peripheralization. So the periphery means, going to the outer edges of things. So peripheralization of pain is when, say, you have some problem in your spine that's pinching nerves, and then that generally starts creating pain that is going down your leg, like sciatic pain. And as that pain is becoming worse and traveling down your leg more and more over time, that's peripheralization, hard to say. And then centralization is when you are starting to resolve that radicular pain. It starts to come back to the source in the spine where that pain is originating from. A lot of times with centralization, you'll feel that, you know what, my foot pain is a lot less now, but boy, my back pain is really hurting, or my butt is really hurting a lot more now. Well, that's actually a good sign, because that means that your pain is becoming more centralized to a smaller zone. And the less you feel that down all of your leg, your brain kind of is getting fewer pain signals from a broader spectrum of tissues. And so it's felt more acutely in the area that is where the problem is happening. So that's centralization and peripheralization of radicular symptoms, different from central pain. I'm going to take a moment here to ask you to please subscribe, like, and share this information with others who are having pain, so that you can help them too. Thank you. Okay, so that covered centralized pain, centralization, and peripheralization. Then we have something called primary pain disorders. And those are pain problems that aren't usually caused by some underlying disease or injury that we currently understand. These things are like irritable bowel syndrome and fibromyalgia and chronic headaches, although I've had pretty good success solving a lot of chronic headaches using the information in my program and my books. Okay, and then we have a term called neuropathic pain, which relates to pain that's sensed by nerves that communicate with your brain. So almost all pain, I guess, could technically be neuropathic pain. But this really relates to things like diabetes-related pain or trigeminal neuralgia. Although I've had pretty good success with helping people with trigeminal neuralgia. The trigeminal nerve is a cranial nerve that originates in your brain that feeds your face. And then we have radicular pain that radiates from the spine to the periphery or legs, which I mentioned earlier. So peripheral pain is pain that's in our periphery, our arms and our legs. That could either be due to some spinal insult that is radiating pain down into the arm or leg, or it could be due to an injury like, say, an Achilles tendon tear that's happening in your ankle. That would be considered peripheral pain too. So my books and programs deal with most chronic pain and peripheral pain and radicular pain, and also often neuropathic pain. So what it doesn't deal with are those pain syndromes that we don't really understand, like irritable bowel syndrome, pain from strokes, or disease processes in the spine. And the way I approach solving most types of pain is that I think of pain as a signal from our bodies that there is a problem right now with our bodies. And so a lot of people are led to believe that, oh, if you've had chronic pain for 20 years, it's going to take 20 years to solve. And usually my experience has been is that if you have chronic pain for 20 years, it just means that no one has figured out the thing that is irritating your body yet. And so if we fix that problem now, your pain will resolve now. Again, this has been my experience. So it shouldn't take a long time to solve chronic pain or to feel that chronic pain is resolving once we isolate the problem that's causing it in the first place. Now, regarding acute pain, like from a fall or a muscle tear or strain or a car accident or something like that, our bodies have amazing internal processes that heal these problems. And so if you tear a muscle, that'll heal in 6 to 8 weeks, sometimes 12, depending on the muscle and where it is. A bone will knit in 6 to 8 weeks. In medicine, that's why we designate something as acute versus chronic, because if you're in that 3-month window, your body's internal processes should be healing most problems if there aren't any other confounding factors. All right? So after that pain has been around for 3 months and then becomes chronic pain, it usually means there's something else going on here that's continually irritating our system. And that's where, actually, frankly, most of the patients I treat have chronic pain conditions. And so what I try to find are those things that are causing chronic pain or causing the body to remain irritated that others haven't found. Well, again, my books go into this, my home programs go into this, but in general, for any kind of spine, pelvic, or SI joint pain, things like that, sciatic pain, usually what's being missed is something in the legs that's feeding into the pelvis and spine. And with regards to upper body radicular pain or neck pain, things like that, what's usually missed is something about the shoulder blade that is not being addressed, that's then stressing the neck or causing radicular symptoms down the arm. So I think an interesting thing that I have discovered is that if you have radicular pain, let's say pain going down your hand, most medical practitioners say, oh, well, you've got a problem in your neck that's then pinching nerves that are running down into your hand. And that's not incorrect, that is correct. But it's usually bigger than that. So usually something that's going on with the upper body system is causing stress to the neck, which then pinches the nerves that feed down the system again. So it becomes this negative loop. And so just solving the neck issue is not solving the system of problems that's usually creating the neck issues in the first place. Same with the spine. So if you have sciatic pain going down your leg, most practitioners will focus on the spine or the pelvis as the source of that pain. While that's accurate, it's not the whole picture. Usually the spine or pelvis is reacting to something else that's occurring in the leg that then causes it to pinch nerves that then radiate back down the leg. So again, that negative loop. So this is why my programs, my books, all the information that I put out there is really about helping people understand the problems away from what most practitioners think of as the source of pain, which is usually the spine or the pelvis or in the neck region, and start considering things that are outside of that localized system. Especially when you have unilateral pain, let's say you have sciatic pain down one leg or radiating pain down one arm, especially when I hear of pain happening on one side of the body, it's usually due to asymmetries in how you're using your body that has then caused asymmetrical forces to act on your spine that then cause these radiating symptoms down one arm or down one leg. So in my books and in my programs, I focus on a lot of unilateral testing and exercises, because you need to understand that if, say, your butt muscle is stronger on your right side than your left side, and you have sciatic pain down your left side, then that is a clue that you should solve your butt weakness on the left side, that it may be one of the sources that is stressing the spine on that left side. So paying attention to asymmetries in how your body is being used, in the length of muscles, in the strength of muscles, especially when you have unilateral pain, like one-sided back pain, sciatic pain, SI joint pain, or neck pain, or headaches on one side of your head, or arm pain, things like that. If you have one-sided pain, it's a pretty good bet that there is something that is occurring on one side of your body that's causing these problems. Most of the time, it's the same side of the body. So if I have left sciatic pain, I would, in 80 to 90% of the cases, the problem will be on that left side. But it's very common, in 10 to 20% of the cases, that problem is actually on the opposite side. And what's really interesting is that our brain has an amazing ability to help us get from A to B. And if it needs to develop compensation patterns to help us do that, it will do that. So if I have a problem on my right side, and then it causes me to overuse my left side, then that left side after time breaks down and causes this left side of pain. But the original problem is on the right side. It's being unloaded. So I hope that helps you understand pain and the different terms that are used for pain, and kind of how I approach solving acute, chronic,